So first we're going to go ahead and do the elbow exam. So you want to make sure to ask the patient if they have any previous neurological symptoms, any previous injuries such as dislocation, and any difficulties with work or sleep. For inspection, you want to go ahead and look at the lateral epicondyle and then the olecranon process. For the anterior aspect, you want to look at the antecubital fossa, the biceps tendon, and the medial epicondyle. Now, one thing that you can have the patient do is have them go ahead and sit down in a chair. Since I don't have a chair with shoulder rest, we're just going to go ahead and do it here. And then go ahead and put your elbows down and then lift up. Okay. If the patient has any pain while standing up in the chair, then that could indicate an injury, and it could be a sign of elbow instability. Now to look at elbow range of motion, I'm going to have you put your elbows into extension with the shoulder and abduction. So go ahead and do that. And then bring elbows into flexion. And then what you can also do is rotation of the forearm. So go ahead and put your thumbs out and just go ahead and bring your thumbs in and bring your thumbs out. And palpation of the elbow in some instances can reproduce the discomfort. For the Cousins test, with resisted active extension in the ring finger can produce pain. So go ahead for the ring finger, go ahead and try to extend it for me. Okay, so that if that causes pain, that could be a sign of an injury. For golfer's elbow, tendinopathy of flexor muscles, it could be painful with resisted flexion of the wrist. So go ahead and try to flex the wrist. Good. And just behind the medial epicondyle, if you put your hands there and passively flex the elbow, it could reproduce pain. For biceps tendinitis, resisted flexion of the elbow could reproduce symptoms. So go ahead and try to flex for me. For triceps tendinitis with resisted extension of the elbow, it could reproduce pain. So go ahead and try to push out for me. Okay. Elbow osteoarthritis, patient's pain could be reproduced by forced extension and forced flexion. Between olecranon process and the lateral epicondyle, pressure of this with the rotation of the forearm could reproduce pain. Now we will go ahead and do the nerve sliders. Since I do not have a ThoroBand, I will just briefly explain how the exercise is done. What you would do is you would go ahead and put the ThoroBand around your neck for the median nerve, and then go ahead and put the other end around your middle finger. You would extend your wrist and your elbow, and then with the band connected to both, you would go ahead and flex your wrist and laterally flex your neck, and then go ahead and extend your wrist and move it to the other side with this movement. For the ulnar nerve, instead of putting it in your middle finger, you would put it on your pinky finger. Then you would move the rope down underneath your medial epicondyle. For the motion, in order to do the nerve sliding, you'll move your head inward and your elbow and hand inward, and then repeat the motion in order to slide the nerve. For the radial nerve, you'll want to go ahead and wrap the ThoroBand around your arm and then put it on your index finger. In order to do the motion, you'll want to go ahead and flex the neck and then bring it back. This will go ahead and slide the radial nerve. For median nerve flossing, you're going to want to go ahead and extend your elbow and then move the wrist down. If this causes pain or anything, you can stop here and go ahead and do sets of 10. Then you can progress to moving your head to the other side and continuing to do this. And then you can even progress to putting your hand against a wall and doing the same motion. For self-massage to the thorax nerve, what you can do is go ahead and get a ball. You can use one bigger than this or this size. And then go ahead and put it on your upper shoulder while laying down. And then you can just do a circular motion and keep moving it inward. What you can also do if you had a bigger ball is go ahead and massage your neck, bring it out and bring it back in. And then lastly, what you can do is go ahead and, if you had a bigger ball, you could use a bigger ball and this ball, and just go ahead and put the ball underneath right here and just slowly rotate in and out to massage that area. In order to floss the spinal accessory nerve, what you want to do is go ahead and retract your shoulder. Of course, you would want to have someone performing this on you in order to help. Retract your shoulder, protract your chin, and go ahead and laterally flex your neck. And just go ahead and keep doing this motion in order to perform the action. For flossing the suprascapular nerve, what you're going to want to go ahead and do is laterally flex your neck, and then go ahead and bring your arm over and just go ahead and keep repeating. Of course, if someone could perform this on you, it would help in order to maintain neck flexion and help get a better stretch. In order to treat for coracobrachialis, what you want to first do is find the coracobrachialis. In order to do this, you want to go ahead and put your hand with where the bicep is, and then go ahead and push up for me. And then that should expose the coracobrachialis. Once you know where it is, in order to treat it, you want to go ahead and kind of massage front and back. And this will help treat coracobrachialis. For dorsoscapular nerve flossing, what you're going to want to do is stabilize the shoulder. Go ahead and put your hand under the scapula and rotate while they end up rotating their head. This will help with the dorsoscapular nerve.